So now we've had a bit of a think about some of the other investigations that we could do in a patient presenting with a fall. Just wanted to go back to just talk about the management of ulcers. So in an arterial ulcer, where they've got an ABPI of less than 0.8, compression banding is contraindicated. This is really important to remember. We shouldn't be giving these patients any sort of TED stockings for venous prophylaxis or compression bandaging. So here, these patients might be needing some form of operation and vascular reconstruction, and then also treatment of the peripheral arterial disease as well. In terms of venous ulcers, so here they'd have a normal ABPI. Here we can give them compression bandaging, and that's thought to encourage the healing of ulcers. And then in a diabetic or neuropathic ulcer, so here ABPI might be normal or less than 0.8 if they've got signs of arterial disease as well. So they might be requiring wound debridement with or without amputation of toes or the foot. But then conservative management might include good nutrition and making sure that they've got good footwear that protects their feet, and also making sure that they regularly check their feet for signs of any sort of skin break and trying to prevent that from becoming an ulcer in the first place. So what happened to Pam? So Pam was referred to the diabetic foot clinic. Her ABPI was 0.9. So that's normal. So she was advised to try conservative measures for her foot ulcer, which included good nutrition, proper footwear. 3 months later, she came back to the diabetic foot clinic for a follow-up. On examination, her ulcer actually looked worse and now appeared infected. So we'd be seeing signs like pus, discharge, erythematous, just unhappy looking. So she's assessed by the vascular surgeon. And unfortunately, the outcome is that she's going to require a foot amputation. So she's referred to the anaesthetist for a preoperative assessment, given her age and comorbidities. So at pre-op assessment, this is usually conducted by an anaesthetist. So they'll take a history, cover a brief history of why they required an operation and the events leading up to this. They'll also cover past medical history, past surgical history, and also past anaesthetic history to know whether they've had any issues in the past. They'll also talk about drug history, which is really important to be able to tell the patient if they need to change any of their drugs prior to the operation or on the day of the operation, and also check allergies. And then it's also worth checking family history, also if any family members have had any issues with anaesthetic in the past, and also social history. For example, they could consider whether a patient requires an interpreter on the day of the operation, or whether they would be able to go home, and if it would be safe for them to go home on the day, if it was a day case procedure following general anaesthetic, as long as they've got someone to look after them at home. And then they'd examine the patient. So this would include a general examination, including airway assessment. So they'd check the patient's neck mobility and make sure that they'd be able to intubate a patient. And then a patient also, they will also grade a patient according to their ASA. So that's looking at how comorbid a patient is, with an ASA of 1 being completely fit and well and with no comorbidities. But it's worth just looking this up, and you'll probably cover it on your surgical placement as well. And then investigations wise, we'd want a patient to have some bloods before an operation, including clotting, and a group and save. So a group and save is where you take a sample of blood and send it to the lab, and they'll check the blood group and things like that, and be ready in case a unit of blood is required. We could also do an ECG, do swabs, for example, MRSA, and in this day and age, COVID swabs as well. And then some patients might require cardiopulmonary exercise testing. So if patients are a bit older and they have a bit more, a few more comorbidities, they can do this test, which involves checking how their heart and lungs function under stress, so that it can help people know whether they might need HDU or ITU after the operation, or whether they might not be fit enough for the operation in general.